as we do gather, I again acknowledge the sacred land on which we gather today, and I gather on the lands of the Wurundjeri people of the Kulin Nations, and I pay my respects to elders past, present and emerging in this land today. And we celebrate the ongoing cultures and connections to the lands and waterways across Victoria and this great nation in which we gather. I can see Leanne on the line there, and I want to welcome you, Leanne, to our forum today. We're looking forward to hearing you speak. But so Dr. Beagley's background includes clinical qualifications in occupational therapy and family therapy, as well as a Masters of Business Leadership and a PhD in Psychology in Organisational Culture and Performance. Now, prior to working at Mental Health Australia, Leanne worked for Western Victoria Primary Health Network as the Chief Executive Officer for 3 years. And with 15 years experience in direct mental health care in clinical settings in Melbourne, Leanne is also a former Director of Mental Health and Drugs at the Victorian Department of Health and Human Services, a role that she held for 5 years. Leanne also has a range of experience as non-executive director on a variety of boards, including the Western Alliance Academic Health Science Centre, Tweedle Child and Family Health Centre, and Eating Disorders Victoria. So without much further ado, I'd welcome Dr. Beagley to speak with us today. Welcome.
Thank you, Luke, and thank you everyone for having me today. It's fantastic to see you all. And I'll be giving my kids the horrors because I want to share a screen and hopefully take you through a bit of a presentation about Mental Health Australia. Can you see that? Can you nod? Thank you. So from the beginning, there we go. All right. So thank you again for having me, and Cheryl and I had a good think about what we could title this presentation and what we could focus on. And really, I'd like to tell you a little bit about Mental Health Australia and some of the thoughts about the national and strategic context that we're working in. Hopefully that will assist you in thinking about your own next steps, both as individuals but also as an organisation. So if I just start with the acknowledgements, and I'm actually on Ngunnawal land here. I'm in Canberra, and thinking of you all in Wurundjeri land and in Melbourne and in the lockdown. And just acknowledge the nurturing of the land by Australia's First Peoples over many, many, many generations. I'd also like to acknowledge Luke and Cheryl and also Jenny Greenham, who's been doing lots of work in the mental health space for Spiritual Health Association, and also acknowledge consumers and carers with lived experience who constantly remind us about what's needed for them and what makes sense to them. And I'd just like to acknowledge those that have inspired me. So I'll talk a little bit about context and about Mental Health Australia, and then move on to some thoughts about what we could all be doing together. So you've heard about me. I'm going to skip that bit. I just wanted to make a personal link for you. This is my late husband, Bill Beagley, who was an Anglican minister who was ordained actually with Stephen Delbridge and his wife and Cheryl as well. And he died last year from cancer. That's my mum and her sister, and that's Bill doing what he loved best, which was spending some time in the spiritual space with people. There's some plaques that we left on a bench in memory of him, because he was also a prison chaplain and spent a lot of time in Port Phillip Prison with people on their journey. And so I just wanted to make the personal link for you, as well as the one that links in my professional life for what I'm doing here and why it's such a privilege to be here. So I'm going to talk about mental health in Australia pre-pandemic, but I reckon this link that I'm about to show you probably does it the best. So let's see if I can do sharing screen YouTube 101. Let's try.
Mental health affects everyone in Australia.
That didn't work, did it? You have to give me your let me see. Can you see that screen now, guys? or are you still looking at my PowerPoint, Cheryl?
You're looking at your PowerPoint, Leanne.
Okay, let me just get out of that. Bear with me, people, because it's probably worth it. I'm hoping it is anyway. Sorry, I'm just struggling to get back to the main. Perhaps I'll leave that. So you're still looking at my presentation now?
Yeah.
Yes. I'm going to leave that link for now. Essentially, and I'll pop it in the chat potentially, and you can have a look at it later. It's basically a 2-minute video from the Productivity Commission, Australia's Productivity Commission, on how when they released their draft report on mental health in Australia. It's a really useful summary of the state of play in Australia in terms of responding to mental ill health. And it's I just thought it'd be a great summary and stop me talking. But anyway, I'll move on. So,
and if you want to put it in the chat and
yeah,
get it ready to play at the end.
Ah, okay, sure. I'll do that when, yeah, thanks, Cheryl. So in terms of, this is my take on pre-pandemic. I think that there's been, over the years, there's been a sort of increasing recognition of the socio-cultural and spiritual aspects of mental health that, and people's mental health presentations, which has moved away from the clinical, biological, and psychological domains into understanding people's the richness of their lives and their experience, and I think that aligns actually beautifully with the clinical definition of spiritual care from Spiritual Health Association. So I think that the more we understand trauma and the more we understand what is a very unique and incredibly positive approach that the Aboriginal groups and the way that they think about social emotional well-being, I think the more we understand the impact of the spiritual domain in people's lives. And I think that over time before the pandemic, there was a lot of work being done to start to get people to think about the context within which serious mental health issues present, and recognising that if you're going to do consumer-based, person-led care, you can't not attend to some of the issues around the cultural and social approach and spiritual issues for people. So communities, belonging and social connection mattered a lot, I think, for understanding mental health and well-being. But before COVID, this was actually quite a hard conversation to have, particularly because our system was so siloed and pressured that there was a real attention to risk and attention to as there should be, symptoms and the sort of biological nature of mental ill health in order to manage access to services. So let me tell you a bit about Mental Health Australia in that context. So it was established as the first independent peak body in Australia to represent the full spectrum of mental health stakeholders and the issues. So essentially gives us a unique capacity to bring everyone to the table. So the members include national organisations representing consumers, carers, special needs groups, clinical providers, professional bodies, and service providers, and also researchers and academics. So it's a very broad spectrum of providers and members. And I guess we have members across the entire spectrum of mental health service delivery. And so if you go down to this pointy end, we know that 3% of the population will experience a serious mental illness each year, and that up this other end, which is about prevention and early intervention and stigma reduction, is really important part of the work of Mental Health Australia, which I'll tell you a bit more about. But we essentially have members who deliver services right down at this really pointy end, the people who are most disadvantaged and unwell, as well as members who like Movember and Are You OK, and those sorts of well-known brands who are working with us at the other end around suicide prevention and stigma reduction. So we've got 125 member organisations representing about 1,250 organisations in the background, advocating for just under 10 million people and an estimated 5 million consumers and carers. So that's a kind of that's the numbers for us. One of our members is Mental Health Victoria, and I understand that Spiritual Health Association are a member of Mental Health Victoria. So that's our link. So I guess what we do, this is us over here, Mental Health Australia. We have a lot of members who are giving us lots of advice about what's happening on the ground and what they see as the key issues. They're advocating for changing attitudes and policy changes at government level, and they're helping us do the same. So that's essentially what I see as I've only been here 6 months, but that's what I see as sort of the key piece of work that Mental Health Australia is doing. Some of the things that we do is endless. This looks like I just go to meetings, which is kind of true in a way, but this is some of the things that we're involved in. And so we have a great opportunity to sit at a senior level to influence and be part of national reform. And that's really exciting. And so in terms of speaking up, we want to be able to speak up at all of these kind of opportunities, but also to speak with authority and be well informed by members and people in the community. So there's a whole lot of submissions that go on, formal submissions. The most recent one you can see there is the joint submission with Suicide Prevention Australia to the Senate Inquiry and the National Commissioner for Defence and Veteran Suicide Prevention Bill. But there's also others that we've done. I had the opportunity to present to the Royal Commission evidence on aged care and mental health in aged care. I was able to speak to the Select Committee on COVID-19 and that's impact in Australia, and had an hour with the senators about the mental health impact. So lovely opportunities to speak with people who are making decisions and thinking in a big picture about the future. We also have a contract to deliver Australia's response to World Mental Health Day. That was last Saturday. So these are some of the things that we did, and I'm very happy to leave this presentation with Cheryl and the team. But it was a strange year. Of course, we had to do lots of digital online work, but we had more than 50 partners and people making many, many promises about their own mental health, and I hope you've had a chance to do that yourselves. We also have a multicultural mental health project that we run, which is about seeking to improve the responses of regular services to people from non-English speaking backgrounds or different cultural groups, as well as working with the communities themselves to better recognise and understand mental ill health. So those are some of the things that we're doing, and that Embrace Multicultural Mental Health website is the one to go to hear more about that work. It's really, I think this is a really exciting program of work for us. And we've got some strategic priorities. This is, what organisations do. We're really keen and we're looking at, and that's why it says draft, we're looking at these strategic priorities for our next little while. One is about really championing and supporting an effective national voice for mental health consumers and carers, so that they continue to fight for and get the support to deliver a system that's truly person-led. We're really interested in the social determinants for mental ill health and looking at prevention, integration, sustainable change in people's lives. This is about the things that really create disadvantage and further alienate people from the communities. It's about housing and financial security and employment and so on. And the third one is to deliver value to members and to the broader sector by doing the work that we do and making sure that we're working in partnership with others. And there is a charter you can have a look at, which was signed by more than 100 organisations, called Time to Fix Mental Health, and we'll be using that charter to drive our next sets of actions. So in amongst all that, we had a pandemic. So I just want to jump quickly to what we know about trauma and trauma in communities, because I think it will help us in thinking about how we respond. I'd like to just acknowledge Rob Gordon. You might know Rob Gordon. He's a Victorian who's been a leader for many years in helping communities and governments understand the impact of trauma on communities. including bushfires and so on. So I just want to acknowledge that this is from some work that he's done. So in terms of his take on some research that happened with the Kentucky flood in America, this is quite a helpful framework because this was a very significant piece of research. Essentially what they found was that there was no significantly increased mental illness per se, but the level of distress that people experienced in that trauma was similar to major life crises like death of spouse or loss of job. And the distress was made up of 4 separate factors. So negative emotions, kind of difficulty thinking or negatively thinking, bodily type problems and things that were expressed through people's bodies, and then reduced positive emotions and attitudes. And the effects shown in those suffering personal loss and those exposed to community destruction, but not loss, were similar. So this is really important. You don't have to lose something or experience something because we're human beings living in communities. You don't have to experience that in order to also experience some of the negative impacts of those traumas, and that it required 2 years to regain pre-disaster health. So I'm going to come back to that because there is a long tail. So in terms of understanding stress responses, this is something we'll all understand, is the physical and mental exhaustion, unable to progress recovery tasks, unable to think clearly and problem solve, and so on. You can read the rest. You know, isolation and poor self-esteem are all issues, and these are things that come from study and research around stress. So what happens to trauma responses? So early post-traumatic stress can be resolved if people deal with it, and many have the capacity to shut it down. But as you get more exhausted, and you know, I think we heard this already this morning, adaptations break down, and so early coping deteriorates, and then you start to see sometimes some post-traumatic stress challenges. And sometimes that anxiety and anger can be expressed in the community and to services, and obviously to leaders as well. And part of that is a threat to identity, and I guess this might be where spiritual health are thinking, in terms of, you know, identity being the product of the reflection of myself and activity in the world around me, and, you know, maintained by a constant reciprocal flow of informal communication. And when you're locked off from the world, that's pretty hard to sustain. So it causes identity loss. You know, things seem unreal and weird. They feel invisible. People feel rejected and forgotten and devalued and helpless. So these are some of the challenges that we know from the research. The things that promote and support identity are about informal, redundant communication, reflective time. Rob was encouraging us to have meetings without agendas, you know, and have chats, because, you know, we don't have those times when you just stand at the water cooler and have a chat at the moment. Communication without request, you know, so talking to people about anything other than business, and encouraging self-expression, which is what we heard actually from the Spiritual Health Australia Association team before. So in terms of recovery during COVID, this was what Rob was suggesting, that we prioritise community building, that we create communication processes any way possible. Talk to each other about what we're doing. The narratives of recovery are important. Value talking and information exchange. Have online meetings to process information and work through tensions and worries. Record things like webinars and talks for groups around their issues. And make links towards the post-COVID future, which is what I'm hoping we'll do today. So in terms of going forward into the post-pandemic world, the first thing I'd say to you is that we're not post-pandemic yet. I have to tell you, I went to the two footy finals in Queensland because I could on the weekend, because ACT, the borders between ACT and Queensland are open. So I flew up there and I went to the AFL footy. It was so awesome. And I don't want to make people in Melbourne jealous, but it was so awesome. But but you know, they are, that was what I observed, was people thinking they were post-COVID, they were post-pandemic there. That, and I'm not sure we are yet post-pandemic, and I think, you know, I think there's a long tail here, and I think we're going to be struggling with this for a while. But the really exciting piece for me is that I've observed the discourse shifting on what we mean when we say mental health. So before COVID, my sense was that when we talked about mental health, we were talking about mental illness, and we're talking we're talking specifically about diagnosed mental illness. And you know, for 30 years I've been in this sector, and that's been one of the key challenges, is that when we talk about mental health, we mean mental illness. What's happened in the and I'd be interested in your observations on this too. What's happened, I think, since COVID, is that when we talk about mental health, it actually means absolutely mental illness, but it also means some of those challenges that we are all facing about disconnection, loneliness, isolation, social disconnection, and some of the challenges, the stress and the traumatic experiences that we're all feeling, which I think are enormously complicated for people who have serious mental illnesses as well. But what we are doing now is having a conversation much more broadly across the community about mental health and well-being being part of everybody's experience and everybody's responsibility, I guess, to think about. And that's a very different place. I think there'll be tensions ahead when we emerge into a new and different world, and there'll be anxieties and fears and a desire for the familiar, but I don't think we can go back to what was before. It's gone, and we're waiting for something new to emerge. And this sense of anxiety about the future is pretty tricky. And I think it's a space that you're probably all working in or engaged with in your day-to-day work. The Productivity Commission report we are awaiting, which is a big and really important piece of work that the Productivity Commission was asked to do by the Treasurer. What we had, for example, when there was a Productivity Commission report on disability, out of which we got the NDIS. So these are really important opportunities for reform. And the Productivity Commission report we're expecting in the next month or so to come out. But these are two relevant recommendations from the draft report that are worth having a look at. The first one is that the social and emotional wellbeing of Aboriginal and Torres Strait Islander people is profoundly influenced by their connection to land, culture, spirituality, family and community. And you know, that model of approach to thinking about social and emotional wellbeing is really instructive for the broader community, and one that you know, I think is really worth thinking about as a relevant recommendation. And you know, I'm hoping that one's there in the, you know, not just in the draft but in the main report that comes. The other one is this issue around single care plan that's needed to help coordinate treatment. And we know that our system is such that, you know, you can't have you have a range of needs, and you go to a range of different people to have your needs supported. And this is the Productivity Commission's approach, which says the coverage of the plan would vary from person to person according to their needs and presumably according to what they want, but could include a plan to address such aspects such as mental health care, physical health care, cultural and spiritual needs, psychosocial support needs, housing needs, community inclusion, the role of carer or kinship group, and the reintegration into education or the workforce. Having this in a document like the Productivity Commission report gives us great hope about some of the policy and future planning that could come from the idea of a single care plan. It's kind of rocket science, not rocket science, is it? But it's really important to see it in such a key document. So, you know, I read that the Spiritual Health Association collective aspiration for meaningful system reform must acknowledge, integrate and make explicit spirituality, spiritual care values and these specialist skill sets as foundational in any person-centred model of care moving forward. So I reckon now is your moment. I'd be inviting you to build the narrative about how inextricable identity and spirituality are, and how important that if you're framing work and responses to people in a person-centred, person-driven care context, it will always include a spiritual domain. And give people the tools and language with which to ask and talk about it. And help people to, particularly policy people, to be able to talk about this critical and important part of people's experience. And I guess this would be a really important point that I would make. Resist the invitation to reduce human suffering to headlines. It's complex, let it be complex. I think we often try to go into, particularly in the work that I do, which is advocating, and where you get 10 or 15 minutes with a minister's advisor or with a minister themselves, and you have to reduce everything down to 3 dot points. And I'm really a bit resistant to that. Humanity is not simple and 3 dot points. Humanity is about complex interfaces with different parts of who we are, and to reduce it down to dot points means we reduce people and their humanity. And just a word for those of you who are supporting and caring for others in your role as health professionals. So we did a survey in the lead up to World Mental Health Day, and we asked, so that was during September, in fact, so very recently. And we asked people about their experience in the healthcare industry, about their experience of COVID. And 67% of them said that working during the COVID pandemic had had a negative effect on their home life. So over 70% of them said, the restrictions had impacted their mental health and wellbeing in a negative way. So this is pretty big news, I think, when we're also asking this group, of which I'm sure many of you are in that space, to keep giving and keep working for others. So during the last 6 months, 26% of these people had reached out to a trusted friend or family member for support, and many of them believe their friends and family have been extremely supportive. When they were asked about specific mental health impacts, 70% cited experiencing prolonged tiredness and fatigue. I'm there. 57% now have problems getting to sleep or staying asleep, and 42% had been experiencing mood swings or finding themselves overreacting to minor issues. So mostly, about half had not sought specific mental health support, but they had advised, through the survey, the things that they'd done to try and maintain good mental health. And that was the things that we're hearing quite a bit about: exercising, cooking more and eating well, spending more time with family and friends, recreational activities and learning a new skill, or even downloading an app. So I'd just be encouraging people to think about that awesome thing. Remember in the old days when we travelled on planes? And we were encouraged to put on our own mask before we put masks on others. And I just encourage you to think about how you do that in order to make the most of your caring and support functions as well. So thanks for having me. So now